All right, let's pick up from that report that was released by the Health Ombudsman, Malegapuru Makgoba, which says that businessman Shonisani Lethole was starved for more than 100 hours. Lethole died at Tembisa Hospital last year. Let's get some reaction from Jack Bloom, who's the DA spokesperson on health in Gauteng. Mr. Bloom, thank you for your time. This was an unnecessary death. We're hearing from the Health Ombudsman that even the medical care for Shonisani Lethole was inadequate. In fact, he said it was substandard. There was no effort whatsoever to offer him CPR despite him being young and without comorbidities. This level of negligence somehow reminds you of that life as a demanding tragedy.
Well, yes, indeed. I think you have to realize that this is only one example. Quite frankly, the Health Ombudsman could probably probe many other instances in many other public hospitals in Gauteng. So it's just the fact that he went into detail in this particular case. So it's really shocking in every way. But I do think that one of these findings should get more attention. The fact that Tembisa Hospital should never have been chosen as a centre for COVID-19 patients in the first place. It was a notorious hospital for being overcrowded, under-equipped, understaffed, and yet it was made into a COVID-19 treatment centre. So, yes, I think there were obviously medical personnel who were to blame. They didn't do their job. But we must look at the broader context, and that this is far more widespread in public hospitals in Gauteng and elsewhere.
Yeah, and the Health Ombuds also saying that the officials that have actually recommended the Tembisa Hospital action must be taken against them. I want us to look at some of the recommendations, that there must be an independent forensic and audit firm that must conduct a competency assessment of the leadership and management at the Tembisa Hospital. There must be a disciplinary committee and hearing against the CEO, the accounting officer at the hospital, and the doctor who was involved. Is that enough to ensure accountability and justice for the family?
Well, I think in this particular case, obviously nothing they do is going to bring the life back of this poor man. I really think that, no apology can ever be enough, but let us learn from this and make sure that it doesn't ever happen again in future. So, yes, I think the individuals concerned need to be disciplined. It needs to go through the processes. But we must look at the broader picture. The Gauteng Health Department has been notorious for many years for being badly managed. Currently, they don't have a head of department. There's an acting head of department. There's a new MEC, and there's many other acting positions. But for years, we've been told that this department is going to be, quote, turned around. It's going to be fixed. But I think there's deep-rooted problems in our public health system that also need to be looked at. You can't just blame one hospital in isolation. I think you need to look at the entire health department and the system as a whole.
Yeah, and when you talk about looking at a broader picture, this incident paints the picture we already know about the state of hospitals and the service that they offer. Some of those hospitals, the cases of negligence in some hospitals. So the question then is, if you're saying it's not enough to take action against a particular individuals, because there's always been promises to turn around the health system in the public health system in the province, who should ultimately then shoulder accountability and responsibility for these failures?
Well, the Gauteng Provincial Government, I think we have to look at Premier David Makgoba, who's made endless promises that he's going to appoint the right people, that he's going to get this department fixed, and yet under his watch we had, life is set in any tragedy. 144 mental health patients died. He brought in new people and vowed that it would never happen again, and here we have a similar incident, and I can tell you now that similar bad treatment is happening in public hospitals elsewhere in Gauteng. I really think that the legacy of this inquiry, hopefully, is that really effective measures are taken to fix up the deep-rooted systemic problems in the Gauteng Health Department, in hospitals and clinics right across the province. Really, this time round, you must do things effectively. We can't have the corruption that we've seen. Again, under Premier David Makgoba's watch, we had this massive corruption with PPE, and we've got other corruption with the wards that were promised for COVID-19 cases that still haven't been built. So honestly, I think that's where the accountability and the buck ultimately rests with the Premier of this province, who really should be held accountable for this as well, ultimately.
Look, because of this negligence, the Gauteng Health Department is also losing a lot of money. This particular hospital is likely going to be sued, and the health department in Gauteng has been sued many times for staggering levels of negligence, and it uses taxpayers' money to settle medical litigation. We're talking billions of rands here. I remember at some point it amounted to almost a third of the province's 56 billion rand budget. This was last year.
Well, that's the potential liability is as high as 20 billion rand, which is about a third of the province's budget. And obviously these cases have to go to court. But really, look, the department ends up spending huge amounts on damages. You can't bring back lives that have been lost or people who have been damaged in our hospital system. And it's time once and for all that money was effectively spent. What we found is that there's huge wastage. They've spent 500 million rand on a hospital, the Anglo-Gold Ashanti Hospital in the Far West Rand, that was supposed to be ready for COVID-19 cases. I don't think it'll ever be ready for cases. It's in the wrong place. They're not going to get the staff to staff this particular hospital in the Far West Rand. I mean, R500 million spent on that. You know, we need the money for vaccines. This is the other big failure. I think that Gauteng needs to do what Western Cape is doing and scour the world, other suppliers, and get extra vaccines to bring this epidemic to a halt. So I think there's a leadership failure at various levels. We can't just stop with the leadership at Tembisa Hospital. We have to go to the department and to the provincial government as a whole.
All right. Jack Bloom, thank you so much for your time.